Thanks for joining us for this webinar on civil society voices for universal health coverage, sharing stories of country-level advocacy for leaving no one behind. Each year on December 12th, as many of you on the line may know, the world marks Universal Health Coverage Day in support of the idea that every person, no matter who they are, where they live, or how much money they have, should be able to access quality health services without suffering financial hardship. This year's UHC Day theme, Unite for Universal Health Coverage, now is the time for collective action, reminds us that everyone has a role to play in making health for all a reality. Civil society organizations in countries around the world play a particularly important role in ensuring that UHC policies are inclusive and equitable, and that the most marginalized and vulnerable populations are not left behind on the road to UHC. I'm so excited to be joined by all of you and by 4 passionate advocates for universal health coverage who we've invited to share their stories of impactful civil society-led UHC advocacy strategies at the country level in celebration of UHC Day. And we'll be starting the presentation in just a moment. Today's UHC Day webinar is brought to you by UHC 2030, the multi-stakeholder partnership that is the global movement to strengthen health systems for universal health coverage as part of the Sustainable Development Goals, and by the Civil Society Engagement Mechanism for UHC 2030. We are the civil society constituency of UHC 2030 and exist to raise CSO voices to ensure that UHC policies are inclusive and equitable, and that systematic attention is given to the most marginalized and vulnerable populations so that no one is left behind. We have over 400 members and growing, and we invite you after the webinar to join us as a member of the Civil Society Engagement Mechanism. More details on how to do that will be provided in a moment. Throughout the presentation today, you'll hear us using the acronym CSEM, which stands for Civil Society Engagement Mechanism. All of us presenting on the webinar today are closely involved with the CSEM's work. My name is Amy Baldasser-Bush. I'm a part of the Civil Society Engagement Mechanism Secretariat, which is hosted at Management Sciences for Health, where I'm a senior director. The other speakers today are all members of the CSEM Advisory Group. They're a group of 18 civil society representatives from around the world, each representing different regions, health issue advocacy areas, and networks, who help to set the priorities for the Civil Society Engagement Mechanism's work based on input from our members, and who help to ensure that civil society priorities are always represented in the UHC 2030 Steering Committee. I'll introduce each speaker in a bit more detail before they make their presentations. For now, as the moderator, I'd like to give you a few tips for using the Zoom platform for today's webinar. As you will have noticed, all participant lines are being muted during the presentations. Please do not turn on your video, as it can slow down the bandwidth of the webinar. We will not be presenting on video either. I've got pictures and lots of exciting details on the slides. We'll ask all 4 presenters to share their stories, and then we'll have time for a Q&A with our panelists. You can type your questions for the panelists into the chat box at any time, and my colleague here will be helping to compile those questions. Once the presentations are over, we'll pose your questions to the panelists. If you need any technical assistance during the webinar, you can use the chat box. We've got folks standing by to help you. Type in your technical challenge, and they can be of assistance. Please also note that the webinar today is being recorded, and it will be posted on the UHC 2030 website if you'd like to share it with colleagues later. Now let's get started with the exciting advocacy stories from the countries. Our first presenter today is Tomoko Fukuda. Tomoko is the advocacy manager at Joycep, the Japanese Organization for International Cooperation in Family Planning, which advocates for sexual reproductive health and rights, women's empowerment, and gender equality in Japan and globally. She's also the Secretary General for the Japan CSO Network on Global Health and is the organizer of the Gender Unit within the SDG's Civil Society Network in Japan. Tomoko is also a steering committee member of the Asia Pacific Alliance for SRHR. She'll be presenting on ensuring civil society participation, the experience of advocating for UHC from Japan. Over to you, Tomoko.
Thank you for the introduction, Amy. So I'll be sharing the story from the civil society in Japan today. So the civil society in Japan that's working on global health, we actually have a platform that was established in 1994. So we're already 23 years since our platform has been established. My organization, JOICEF, has been the secretariat for all these years. And with this platform, what we do is we have regular bi-monthly dialogues with the Ministry of Foreign Affairs on global health issues. We've had 141 meetings so far, and we have about 30 members in this organization. And we are NGOs working in, some are working in children's health, some are working with community health, nutrition, HIV/AIDS, tuberculosis, neglected tropical diseases. We work in sexual reproductive health and rights. So we are a group of civil societies working in various issues in health. And these platforms help us to have direct dialogues with the Japanese government, and we're able to advocate with them with what our needs and messages are, and we can also have honest dialogues together with them. So this is the introduction of our platform. This is a picture of us that met last month. So although we're already 23 years, we actually have almost close to 30 members who participate in these meetings. So we have quite an active kind of a platform. And as probably most of you all know, the Japanese government has been one of the champions in the UHC movement. They were one of the ones who really pushed forward UHC from the very beginning. So the challenge of us civil society has not been to try to convince the Japanese government that UHC is important. They were already convinced that UHC was important, but our role was more to make sure that civil society was included in the spaces for discussion, the processes, that our voices, our ideas were reflected into the policies that they put forth, that it left no one behind, and that people are the center of what they put forth. So that was our role. One of the key moments that we experienced was in 2016 when the Japanese government hosted the Ise-shima G7 summit. We knew that they were going to put universal health coverage on their agenda. So one of our key objectives was make sure that the policies they put forth leaves no one behind, places primary health care and essential services as the fundamental priority of what they are going to promote. And we also wanted to influence the other countries, not only Japan, but the other G7 countries. So we worked together with civil society from the UK and Germany and the other G7 countries to try to have a collaborative kind of effort to try to push universal health coverage that leaves no one behind. And then another key moment came up last year in December in 2017 when the Japanese government hosted the UHC forum in Tokyo. And at this place, we also wanted to make sure that civil society was very much a part of organizing this forum in terms of having our voices heard. And for this, the Japanese CSO network, we couldn't do this alone. So we closely worked with the UHC 2030 Civil Society Engagement Mechanism. We worked with the UHC Coalition. We worked with and the other organizing partners. We worked together with them. And one of the outcomes that came out of it was that we wanted, we asked for some space for civil society. As a result, the civil society was entrusted to organize a UHC public event, which was a venue for us to really voice our opinions. So that was one. We also wanted to influence the main forum itself and what was presented there. We wanted to make sure that civil society was part of the presenters and the panels. And during the forum, we even found that there was not going to be civil society towards the end of the forums. We advocated from the Japan side, we advocated from global side to make sure civil society was included. And we actually had last minute decisions made so that one of our civil society representatives could be a part of the closing ceremony and present her statement at the closing, which was very big for us, so that we are sure that all the governments that were participating in this forum could really hear us. So this was a kind of a collaborated kind of effort between Japanese civil society and the global civil society network. So in the UHC public event, we actually had almost 500 people who came to this event. We had Tedros from WHO, we had Jim Kim from the World Bank, we had ministers of health, finance, foreign affairs in Japan. So we had lots of high-level people participating in this event. And we had different civil society come up and voice their own opinions. And we had different stakeholders like parliamentarians from Malawi. We had Young Doctors Network working on universal health coverage, talk about their needs. And so we had different people come and voice their opinions on a big stage like this. So in wrap up and in conclusion, governments are becoming more convinced to strive for a universal health coverage. I think there's a global movement that's really pushing forward. And of course, we still need to work with governments to make sure that they are for universal health coverage and that they will push for universal health coverage in their countries. But the role of civil society will start to shift from merely pushing for universal health coverage, but we have to become more watchful on how universal health coverage is going to be realized in their respective countries. There's a need to constantly advocate for civil society space and participation in the various processes, in the plannings, in the monitorings, and evaluation for accountability. And so we need to make sure that governments are accountable to their commitments, make sure that money is put in the right place, it's used efficiently, it reflects the needs of the people. So it's very keen that we are there to make sure that all of this is happening in the countries according to what our needs are and what our thoughts are. So thank you very much.
Wonderful. Thanks, Tomoko. And that was an excellent starting presentation, giving us sort of a high-level overview of not only the country-level advocacy, but also how that advocacy coalition partnered to really make an impact in global spaces. I think 2019 is a year coming up where universal health coverage will be on many global agendas, and where the role of country-level advocates in pushing their governments and the multilateral platforms they're a part of to continue to fight for universal health coverage that leaves no one behind will be so important. Our next presentation comes from Kenya, another country that we've seen a lot in the news lately about their the country commitments to universal health coverage. We're very pleased to have with us as a presenter Rachel Ndirangu, who is the Health Program Manager, Africa, Christian Aid. She's also the Community Health Advisor there. Christian Aid is an international development and humanitarian organization delivering health work in 8 countries in Africa. Rachel's background is that she's a community health and development specialist with over 12 years experience in programming, policy, and advocacy in community health and systems strengthening. And Rachel will be presenting today on citizen voice and participation in UHC processes in Kenya. So over to you, Rachel.
Hi, everyone, and happy UHC Day. So it's really exciting to be part of this very important day. And I'll be presenting about our work in Kenya, the civil society work in Kenya. And as Amy has just said, we are excited in Kenya to be launching the UHC journey tomorrow, led by the president. So we hope to be part of this movement and as civil society to work side by side with the government. So Christian Aid is an international development organization. We've been providing development and humanitarian programs in over 37 countries over the last more than 70 years, working with local partners, international partners. We also work with civil society organizations as partners on the ground to empower and enable socially included communities to claim their rights. And we see the UHC movement as part of that call to be able to make sure that communities are actually at the center of the right to health justice. So as countries are prioritizing and increasing focus on UHC, in their national agenda, meaningful engagement of citizens and ownership to ensure policies reflect their needs remain a challenge. And part of our role as an organization that supports civil society engagement will be to make sure that civil society voice actually plays a critical role in those agendas. And as Christian Aid, we are promoting the voice and engagement of citizens across our countries, including Nigeria, Kenya, Malawi, and Sierra Leone. And I'll be sharing the Kenya example. So, so in December 2017, the UHC, the Kenya government declared UHC one of the big four agenda. And the Health NGO Network, which is a network that brings together all non-state actors, especially the civil society non-state actors, working on health to come together, advocate, promote the right to health, and make sure that government policies are responsive. Put together, put the UHC agenda as part of its work. And so from that day, they've been trying to a lot to engage with government and other actors in the UHC conversation in Kenya to make sure that citizens' needs are put at the center. So due to that kind of engagement, earlier in the year, Harriet was actually nominated into the government-led panel or advisory board for developing the health benefits package. And so one of the advantages was that Harriet was able now to contact its members to make sure that the needs of the communities are brought into that discussion. So the part of the experience that we have and the lessons that we are learning is that there's need for effective CSOs and community engagement in policy design and accountability for the success of UHC. And even where there's already political will, like Kenya now, we are enjoying the political will and not just will, but leadership by the government in delivering UHC. CSO's role remains a key priority. And I think we have a big opportunity, even as civil society now, to ensure that government delivers on its commitment, but also most importantly, that citizens continue to be aware of their rights, they claim their rights, so they should know that it's not just free services that is being offered to them, but it's services that they are paying through their own taxes. And therefore, they have a big responsibility to hold the government to account, but also to play their role in taking up the services and ensuring that they're also giving feedback to how the services are being delivered. We also need to promote and support exchange of learning across countries and regions on effective civil society engagement in advocacy. And that is one of the roles that we hope as Christian Aid we can continue to work with other NGOs to support civil society to exchange lessons and learning. We just heard about some good lessons from Asia. We hope to be able to be part of a process that continues to promote that exchange of learning. And yeah, as we continue to commemorate the UHC Day, As Christian Aid, we just launched a new strategy the other day that calls for united and standing with all for dignity, equality, and justice. And we are saying that there's no health for all without dignity. Health for all means dignity, justice, and equality for all. Thank you very much.
Thanks, Rachel. What a great reminder for UHC Day, and great to hear the story of how civil society has been working in the context of political will to look at accountability and really bringing citizens' needs into the design of those benefit packages. It'd be interesting to talk about that later, and really appreciate the participation of the various country civil society representatives in this webinar, which is made to do exactly what you were saying, doing that sharing amongst countries and helping us all as advocates in this space sort of strategize and learn from each other about what was effective and how we can support each other in our work around UHC. Up next, we have another great sort of case study of work from our colleague Harriet Adong, who's the executive director of the Foundation for Integrated Rural Development in Uganda. FIRD is a community-based organization committed to achieving gender equality, addressing gender-based violence, sexual and reproductive health and rights, promoting sustainable development, and human rights for improved quality and livelihoods in rural communities in northern Uganda. In addition to her role on the CSEM Advisory Group, we're also proud that Harriet is one of our representatives on the UHC 2030 Steering Committee. She's the community-based organization's alternate rep there and will be helping to represent civil society voices in the UHC 2030 Steering Committee later on this week. Right now, Harriet's going to join us to share her experience of the community-based path to achieving universal health coverage in Uganda. Over to you, Harriet, and welcome.
Thank you, Amy. Happy UHC Day as well, and greetings from Uganda. Just as Amy has introduced, FAD is basically a community-based organization that was established in 2005, and we started our work and journey during the conflict time as Uganda. The community I came in was ravaged by war for over 20 years. So FAD currently is advocating for UHC in the aspect of supporting communities and young people, especially on issues of sexual reproductive health and rights. And we are the lead youth advocacy network. As an organization, we have members of 30 community-based members who are part of this network that is literally advocating for access to quality services for young people in the community, and also women and girls mostly. And at the same time, we're also advocating for budgetary allocations to ensure that at the community level, the district level, issues of reproductive health and rights are mainstreamed within the budget to ensure that young people have access to services. And we're also mostly pushing for community-based healthcare services, where we are currently engaging in community mobile health clinics to ensure that we reach those that are hard to reach and underdeserved in the rural communities, who basically represent the biggest percentage of those in need in the community in northern Uganda. For Uganda, basically, we still have a number of challenges in achieving UHC, and one of our biggest issue currently is the health financing, which is still a big issue for us, and the infrastructure, because as I told you, why we're engaging into the mobile health clinics is because most of the communities that we work in don't have access to health infrastructure. And like today, as we're celebrating the UHC, we had to take our mobile health clinic in a community that doesn't even have a maternal health center because there is no infrastructure there, and the mothers don't have places to go to access these healthcare services or delivery centers. So the mobile health clinics have played a key role to help us reach those that cannot be reached in the most rural, hard to reach. And another challenge is the donor dependence in the health sector. The biggest percentage of our health sector is donor funded, and we don't have a lot of funding to support that department or that sector. And challenges also come in the aspect of human resources, where we don't have so many health workers within the rural communities that can population there to access healthcare services. And in addition to that, we've also had challenges between the national donor and CBO relationship, where you find community-based organizations are not really funded in terms of financial support to ensure that we help the communities access healthcare or health services. And above all, because most of the donations is taken to the national level, and so those at the grassroots normally have challenges in accessing services. And I could also talk about the policy aspect. Uganda has a lot of policies, but the commitment to implementation is one of the biggest challenges that we have. And I think that's one of the issues that has currently affected the access to quality service or quality healthcare in Uganda. Because if these policies were actually being implemented, I think we would be able to achieve UHC, and we hope now that the UHC has been recognized globally, probably this is something that I believe my country could look into and probably pick a leaf from Kenya that has currently piloted this whole aspect. And we have hope. We're not giving up, because we know for every process to have a success, there's always hope to get to somewhere that you have to start. As for Uganda, I think we have some positives, I could say. It's not all negative. We've had a couple of successes, and right now, as I speak, a lot of NGOs, CBOs, and NGOs at the national level are building partnerships with the private sectors to see how do we build a momentum to ensure that we embrace the ideology of UHC and ensure that we bring healthcare and support the communities to have access to health. And the good thing with us is that the government has kind of has provided a space where CSOs can, at the national level, can have conversations with the parliament in terms of how do we make sure that we support the community. So that for us as CSOs is something that we can embrace, because there is space for us to talk with the government in terms of reaching out to the parliamentarians. For example, we have a network that is called CSBAG, which is mostly a network that looks at advocacy for budget allocation. So at least this network represents civil society with the parliamentarians or with the policymakers. And that's a platform that we think has played a key role. And in addition to that, civil society has been able to develop different tracking systems to monitor service delivery at the grassroots level. And some of these are like the scorecards that we're using to ensure that how do we monitor service delivery? How do we monitor if we have enough human resources for health? And this has kind of helped to create a platform for civil society to engage in advocacy at that level. And as I conclude, mostly, as civil society, we know we still play a key role in ensuring that we work together with the government. And I believe that it's not about working against, it's about working together. Because if we join hands together, then that is the only way that we can achieve healthcare, we can achieve UHC, we can remove all the barriers that could prevent people's access to healthcare and services. Although we still have that limited commitment in terms of the percentage that the government has allocated to healthcare, which is 5% of our annual budget. It's still low in accordance to the 15% Abuja Declaration commitment. But we believe as a country, there is still much to do, and together with civil society, I believe that there can always be opportunities of working together to ensure we achieve what we want to achieve. And lastly, all I can say is, despite all this support, we still have the shrinking space in Uganda. And with all these restrictive laws, it hinders sometimes, most times I could say, the civil society's ability to hold government accountable. But I know that if we work together from the grassroots to the national level, there's always going to be impact. There's always going to be opportunity for us to bridge this gap and ensure that we achieve the UHC 2030 agenda, if only we work together in partnership with the government and all the different stakeholders at the grassroots, for example, and bridge that gap whereby we bring the community-based organizations on the table. Because as we know, we cannot promote good systems to achieve UHC. Even the community that has to participate, the voices of those that are being affected, the voices of those that need these services need to be brought on board such that we ensure that we have both voices from the grassroots, the national and then the international level if we're to achieve the UHC 2030 agenda. Thank you very much.
Thank you so much, Harriet, and your presentation beautifully connects to the UHC Day theme of, uniting for universal health coverage. Thanks for bringing out that story of how we need to work together in partnership, and particularly highlighting the important role of community-based and grassroots level organizations. Your presentation also started to pick up on some of the themes of our last presenter about some of the health financing challenges and the resource needs. So I'll happy to welcome now our final speaker for the webinar today, Itai Rusike. Itai is a public health activist with almost 20 years experience organizing the involvement of communities in health actions in Zimbabwe. He joined the Community Working Group on Health in Zimbabwe at its inception in early 1998 and rose through the ranks from a field officer first to a health education officer to program manager, and today he's the executive director. Congratulations, Itai. Itai is going to share with us some of the experience of realizing UHC in Zimbabwe and some exciting progress that they've made on implementing domestic health financing policies. So welcome, Itai.
Yes, thank you very much, and a happy officially recognized UHC Day, dearest comrades and friends. Yes, my name is Itai Rusike, and I'm from Zimbabwe, a country that really showed a lot of promise at independence in 1980. And after adopting, the primary healthcare approach and the Alma Ata principles, Zimbabwe became one of the best models in terms of moving towards, health for all, and major gains were achieved, excellent health outcome indicators, maternal and child mortality. Unfortunately, 10 years later, most of those gains were lost, mainly because of a number of factors, including the Economic Structural Adjustment Program. So it then became, apparent that, community participation was then required, and as a result, in late 1998, the Community Working Group on Health was formed, mainly to enhance community participation in health in Zimbabwe. As you have heard also from my colleagues from Japan, from Kenya, and also from Uganda, our biggest challenge is on domestic health financing. If you look at a country like Zimbabwe, almost 18 years after, signing the Abuja commitment of allocating at least 15%, of the total health, of the total budget to health, Zimbabwe is still falling short of meeting that commitment. And as a result, you do realize that the country is still, allocating way below the 15% and at around about 9%, 8.9%. And that is not sufficient for us as a country to meet the health needs of the population. And we are in a country where less than 10% of our people have got medical insurance cover, meaning that majority of the people, they rely on the public health delivery system, and unfortunately, they also do not have any safety net. So it then becomes very important for the country to look at domestic health financing in terms of especially innovative domestic health financing. And as you are aware, Zimbabwe is also one of the countries in the Southern African region that has got a high burden of HIV. And we were also the first country, after declaring, HIV/AIDS, a national emergency, to come up with an innovative, a domestic, health financing strategy in the form of the AIDS levy. And this was an earmarked, fund in terms of trying to address and mitigate, the challenges of HIV. But we are also operating in an environment where the biggest, funders of our health delivery system are external. And as a result, it creates some security challenges in terms of sustainability in the event that, the donors, they then realize or they then decide to leave the country, either because of the political situation and so forth. And if you look at our current health budget, the bulk of our health budget goes towards the employment costs. And as a result, year in, year out, we always face challenges in terms of stockouts of medicines, perennial strike actions by doctors, poor equipment in our hospitals, emergency services, like ambulances, lack of equipment and so forth, mainly because of, the inadequacy of the budget. But despite all these challenges, there are also some success stories, from Zimbabwe that we are always happy to share, especially when it comes to the issue of, innovative, domestic health financing. And in Zimbabwe, despite the high polarization, I think Parliament has really given civil society space in terms of collaboration and partnership. And every year, we get a chance to participate in the budget process. And the budget process also gives, communities an opportunity to give their views, to give their input on what sort of health budget do they want to see. So through the collaboration with the Parliamentary Portfolio Committee on Health, the Parliament of Zimbabwe, we have seen, the introduction of the health levy. And if you look at the health levy, this is also one of the innovations that the country has come up with. And the health levies, on mobile airtime and data bundles. And this money then goes towards the trying to address the perennial, drug shortages in our public health institutions. And similarly, the country has also come up with the health policies that can move us towards, realizing, a universal health coverage. You look at the National Health Financing Policy and the National Health Financing Strategy. And a few years ago, we also had an opportunity as civil society, to participate in the, reviewing of the national constitution. And we are now one of the, few countries, in the region to have the right to health, embedded in our national constitution. I think the same with Kenya, the same with South Africa and Ghana. And that is the bottom line that, Africa needs in terms of showing, the political will and the political commitment. And then if you look at the budget process itself, I think the budget process previously you'd find budgets were crafted by technocrats, but now we are now putting people at the center of the health process by making sure that their views are also, taken on board. But looking also at Zimbabwe, you'd also notice that civil society, despite the shrinking space, I think health civil society organizations have been taking advantage of the little windows of opportunities that exist in terms of, sitting on the table, in terms of also making sure that we take the input of the wider stakeholders in health processes, and also making sure that decisions that are made, within the public health delivery system, realize that communities are key if we are to move, towards UHC. Because UHC should not just about, the technocrats or the health workers. at the end of the day, I think it is important that community health workers should also be recognized and acknowledged, and their role should be appreciated. And it is also equally important that the media plays its critical role in terms of highlighting, the issues. And as an organization, we have identified the media as one of the key partners in terms of highlighting, healthy concerns from communities, in terms of also highlighting whether it's the leakages in the budget, in terms of also holding the authorities accountable. So let me end by saying African governments have an obligation to mobilize domestic resources towards, meeting universal health coverage. Thank you very much.
Thanks, thanks, Itai. Conclusion to bring together a number of the themes that we've heard already in the other presentations about accountability, about financing, about all the partners that need to be at the table, and the importance of bringing citizen and community voices. We now have time, a little over 15 minutes for a questions and answer period. I'm sure that many of you online have more questions about how our advocacy colleagues who presented today were able to make the gains that they've made in their countries. A reminder that you can submit your questions through the chat box. Please make sure that they're sent to everyone so everybody can see what you're asking, and so that we can compile them here on our end for the panelists. If you have any challenges submitting your questions, again, just flag it in the box, or you can email us at csem@msh.org. But it looks like the platform's working pretty well for everybody who's online. While we wait for those first questions to come in, I'll pose a couple of questions to the panelists myself. But everyone, please feel free to type in your questions to the chat box. Rachel, I wanted to start with you. I thought there was something really interesting that you said about making sure that citizens understood that, they're not just receiving free health services, it's their tax money going into that system, right? That they have a right to demand that access and to quality of care, and also that they have a right to sort of input to what they want to see in the package. I think, doing advocacy around universal health coverage can be challenging because we've heard that many civil society groups, even representatives in government, don't understand what UHC means. And so I wonder how you as advocates in Kenya have been sharing that message with communities. How do you help citizens understand the importance of universal health coverage and why they should get engaged in calling for it and demanding their right to health?
Thank you, Amy. Absolutely. And I think, as you rightly said, the civil society community has a big challenge and responsibility, because as representatives of citizens, then we have a responsibility to make sure that citizens actually understand what the universal health coverage means, and that they are really able to know what is expected of the government for them. And one of the things that the civil society in Kenya is doing is and aims to do actually is to accompany the government process as they roll out the UHC agenda and roadmap, to make sure that even as in the 4 pilot counties where UHC will be rolled tomorrow, that the registration for UHC is not just a process to get numbers on board, but it's a process that really enlightens citizens on their entitlement. It's a process that empowers the communities to be able to ask questions. It's a process that enables the communities to be able to put their expectations on the table, even as they engage with uptake of services. And therefore, that is the encouragement that I would also want to give here. So even where universal health coverage is being rolled out, let us be part of the process that accompanies community to understand their entitlement, the right, and to be able to express their needs and ask questions where they need to understand more information.
Thank you very much. It's really helpful to hear the process as it's developing in Kenya, and we'll be watching those pilot communities and look forward to updates from you on how it's going. I wanted to ask a question next of Tomoko. You know, everyone can see on the screen that there is an umbrella, right? And that the UHC Day logo is an umbrella, and we talk about universal health coverage as a sort of umbrella advocacy issue. And I thought it was interesting when you were talking about your coalition. Actually, it applies to, I think, many of the coalitions we talked about today, that there are so many different issue areas for advocacy. You've got folks from the maternal child health community, SRH, RHIV, neglected tropical diseases, all of these important sort of vertical programs. I wondered if you could talk about how you work together with those advocates that have so many different health agendas, using the UHC message, the UHC advocacy, as kind of an umbrella.
Thank you, Amy. So yes, we're people working from different areas in the coalition, and I think with universal health coverage, we have to everybody has to come behind universal health coverage, regardless of what specific health issue topic we've been working on, because if we achieve universal health coverage, it's going to benefit all of us. It means better health care for mothers. It's going to mean treatment for people with infectious diseases. It means that everybody is going to benefit, and we cannot do this alone. I mean, the people working only in a certain specific area of health is not going to be able to push our governments to achieve universal health coverage. So I think we have a very good understanding among the whole group that pushing for universal health coverage is going to benefit all of us. So it's not a matter of trying to see whether we are visible in this movement, but I think we have to have a collective understanding that pushing this together will really benefit all of us.
Great, thanks. Again, we encourage those of you listening in to the webinar to submit any questions you may have. I'm enjoying the moderator's prerogative of asking the questions that came up to me, but you're welcome to pose your questions in the chat if you have any. I have a question now for Harriet. It was interesting and really encouraging to hear you talking about the government having provided a space at the national level for civil society and the community to engage with parliamentarians. We also heard a little bit about that from Itai, and I think it's an important point of how civil society may partner with parliamentarians in sort of advancing our demands for UHC. And I wondered if you could talk a little bit more about how that process has gone, what it's like when you sort of meet with the parliamentarians at the national level, and if they've actually been able to, and willing and receptive to helping to push for the advocacy requests from the communities.
Thank you very much, Amy. Well, I think from the Ugandan context, in terms of creating a space for the civil society at the national level, that has been going on at least well. Not perfect, but at least there is some opportunities for the civil societies to meet with the leaders at that level. And even at the community level, we've had that opportunity to engage with the leaders because we've made sure we create a good relationship with the leaders who are the district leaders. And they've been really very supportive in terms of helping us and hear what the community has to say, and supporting in terms of how do we make amends and create budget allocations to the requests of the community. For example, I can give the example right now through the Community Youth Advocacy Network. We've been able to secure some funding for the sexual reproductive health and rights of young people in northern Uganda, and the leaders have been very receptive in terms of ensuring that they create a budget line to support the young people on issues of sexual reproductive health and rights, and that's at the community level. And at the national level, at least like I say, the CSBAG network is the one that has been taking lead in terms of advocacy on issues of budget allocations, representing the civil society voice. And there have been a number of engagements at that level, and the leaders have been really receptive in supporting the the CSBAG network to ensure that the voices of the civil society is heard as well at that level, and also push for the records. Of course, as we all know, it's not, there are also challenges in terms of funding. So you find that most of the funding that comes in is already reallocated to particular sectors, and it's not very easy still for this to be done immediately. So it's still a process, and that's why you see we're still at the 5.7% of the annual budget of the government, which of course we believe if we continue pushing for advocacy, pushing for the need to increase the budget lines of the health sector, then I believe probably that can pick up at some point. But at the point right now, we're still there. We're still engaging in those discussions. Of course, it's a process, but we know there's a step to everything. There's somewhere a point of start. And right now, the fact that the UHC has been globally recognized, probably that's another opportunity for us to see, okay, come on, this is now a internationally recognized day. It's not just something that we think civil society is pushing for at the grassroots or underneath, but it is something that we think is a global need. It is a human rights need. It's an issue that is not affecting Uganda. It's affecting each and everybody globally. And that's why you see there's a global movement right now pushing for UHC. So for me, I think that's something that we think if we join hands together and learn from every country that has gained and succeeded in each of their advocacy through achieving UHC. If all countries everywhere can learn from those that have some positive feedback, some feedback to show that, yes, we've done it and it has worked, how can other countries also pick this up? So I think as civil society, we know we still have a road to do, a work to do, a push to the leaders. And I think it's not, we're not yet there. That's all I can say. I think it's still a process. We're yet to get there. Thank you very much.
So beautifully said, Harriet. Thank you. I want to pick up on a comment that came in from one of our CSEM members in the chat box from Thomas at Medicus Mundi, and he's talking about the importance of emphasizing the right to health and healthcare rather than a narrative of caring for those left behind. I want to clarify that I think in our advocacy messages around UHC Day, we're not talking about caring for those left behind. We're talking about exactly what you've heard from the panelists here. Those that are often left out of the conversation, not at the table, as Itai was saying, right? Their rights and their needs not being considered, left behind as policies and programs are being put in place. How do we empower and bring them into the conversation? But Thomas also makes the very important point that beneficiaries or maybe targets of our engagement for UHC should be the national health authorities. How can we help to enable them to better fulfill their obligation? I think that's a really important point and links to some of what Itai was talking about in terms of the accountability push and the close work with authorities who really have the responsibility for meeting Abuja commitments, right, for financing health. And I wonder if you want to talk a little bit more about how you've sort of engaged, as Tomas is pointing out there, in helping to sort of support and encourage those national health authorities to keep their promises around UHC.
Yes, thank you very much to Thomas, a very dear colleague, who is very passionate about, tax-funded, public-funded, health delivery systems. I think what we need is we want governments that are, capacitated in terms of them, providing a service to the vulnerable groups. It is the government's responsibility to take care of its people. But for the government to be able to do that, they need resources. So this is why it is important that we have, a public tax-funded, a health delivery system from our taxes. And this is where Parliament also then comes in to play a very important role in terms of how do we share the fiscal cake, the national cake, and in terms of also prioritizing, the health sector on resource allocations. So it is also equally important, I think, at country level to be able to then regulate, the private sector. I know during the Astana conference, as the world was commemorating, 40 years of the Alma Ata, Medgas Mundi, WEMOS, including other progressive organizations, were now pushing for the new global, economic order, which I think is very important in making sure that for the government to be able to deliver services, governments have to, have the adequate, especially at national level. And this is why, as civil society organizations, we have been pushing for such regional commitments like the Abuja commitment of allocating at least 15%. But what we are also saying is the 15% should also be used efficiently, so that the money can reach especially the vulnerable groups. And what we also need to remove is the out-of-pocket costs, especially the user fees at the point of entry, because that's an unnecessary barrier. And what we have seen, especially in Africa, once there's a fee element, it also kills the health-seeking behavior. So I still feel that for us to be able to move towards the universal health coverage, that will not happen by relying on external funding. National governments have to make a commitment, show leadership and political will in terms of putting its own resources, to the health sector, and let the, development partners come in and play a complementary role, rather than what we see in most African countries, where there are more resources that are coming from outside than what we are putting ourselves as national governments. Thank you.
Thanks, Itai. We're almost at the end of our time together, but another interesting question has come in. So this will be our last one. A point from a colleague in India talking about the shrinking policy space for civil society engagement. This is something that came up in a few of your presentations, and she's noting that it's a major concern also in India. Any recommendations from the panelists as a sort of closing question and discussion point on strategies that may be working to revive the trust between governments and civil society and to develop more conducive environments for civil society advocacy? Any one of the panelists want to share some final thoughts on that? Yes, please.
Yes, I'm coming from a country, Zimbabwe, where space has been shrinking over the years. But one of the strategies that we used as civil society organizations was to have like institutional relationships, with parliament, through the signing of MOUs, so that the relationship is not driven by personalities. And similarly, we have done the same even with the Ministry of Health, where our relationship with the Ministry of Health is institutional. But of course, making sure that as civil society, we maintain our autonomy, our independence, and we don't get too close, to the state. But generally, space, whether it's in Africa, whether it's in Asia, has been shrinking. But there are, windows of opportunities that civil society can take advantage of, in making sure that for us to be able to influence the health agenda, we can't be on the sidelines. We have to be part of the process.
And that's an excellent transition into the reminder I want to share with everyone on the webinar that this is the first of what will be a continuing webinar series where we share experiences from civil society advocates for universal health coverage. And I've got it firmly on my list that a future conversation could perhaps focus around how we work within those shrinking spaces and to change those spaces. We want to thank you again for joining us to celebrate UHC Day 2018, and we encourage encourage you to move forward with us on this UHC Day advocacy every day of the year by joining the Civil Society Engagement Mechanism. You can send an email to the email address you're seeing on the screen, csem@msh.org, and we'll send you the link to join. That'll also sign you up to receive our newsletter full of interesting country level and global opportunities to engage in UNHC advocacy. We also encourage you today to follow us on Twitter at CSOs for UHC and to join the conversation, amplify the messages. As some of the panelists have mentioned, this is UHC Day has been happening for a number of years, but it's the first time that it's a internationally official recognized day by the United Nations, putting again, as the panelists have said, the emphasis on the importance at country level and in the global community of this commitment to meeting the UHC health for all requirements that are embedded in the Sustainable Development Goals. Those of us on the webinar today are here in New York at the United Nations specifically for that reason. We'll be raising the voices and the calls for civil society engagement, for space, for leaving no one behind today here in New York, and we look forward to sharing the stories of all of you who are mobilizing, rallying, marching, tweeting, hackathoning around the world to draw attention to the importance of universal health coverage and uniting around this agenda. So please join me virtually in thanking our panelists for today. Thank you all for joining, and we look forward to connecting with you on the next Civil Society Engagement Mechanism and UHC 2030 hosted webinar. Happy UHC Day. Thanks, everyone.
Thank you.
Thank you.